Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 288 of the Ask Dr. Angela podcast. So this past weekend, I think Saturday, was National Pizza Day, and I was so excited about that. We actually made pizza in my house. I cheated a little bit. I was actually really crazy busy this weekend, and I did get everything to prepare the dough, but my Minnie decided that she just wanted me to use, quesadillas and make the pizza on that. And I got to tell you, it was brilliant. They were like these personal sized pizzas, and we put the sauce on and then cheese and I don't know. What do you like on your pizza? Anyway, on mine, I had cheese, green peppers, onions. I had pineapples, mushrooms. Then we made some with chicken. I mean, just deliciousness. But that was kind of fun. And then, of course, I'm a Midwesterner, so I was thinking about East Coast pizza versus Midwest pizza. And, of course, in Chicago, they have that deep dish pizza, which is delicious. And then out east, we have, big pies. I don't know that there's really any comparison. I guess it just really is a matter of preference. I do like both, and I don't know that I could honestly say that I prefer one over the other. So that I get a lot of queries from all over the world, from all kinds of journals, magazines, media outlets, etc. And I was recently asked about endometriosis. They're like, Dr. Angela, can you give us the rundown on endometriosis? And so I said, sure, I can give you a rundown on endometriosis. First of all, what the heck is endometriosis? Endometriosis is a condition where parts of the lining of your uterus, which you typically shed every month as your period, instead of coming out through your cervix and vagina in the regular period, some of this lining gets shot out through your fallopian tubes, and then it implants on various parts of your abdomen and pelvis. Signs and symptoms of endometriosis, this is easy. The hallmark or pathognomic finding for endometriosis is cyclical painful periods. So whenever I have a woman or a young lady that comes to me and she goes, oh my gosh, Dr. Angela, my periods are painful. Every time they're painful, I always think of endometriosis. Pain with sex, that's another finding. Sometimes people have bowel or bladder issues. You might be constipated. You might have diarrhea. Sometimes you have pain when you pee, this kind of thing. Your periods can be heavy. They can be heavy and irregular. People with endometriosis can also have issues with fertility, because endometriosis can certainly cause a lot of scarring, and scarring can cause obstruction with the fallopian tubes and the fallopian tube's ability to catch the egg from the ovary and help transport it, through the tube and into the uterus. So, in someone that has a history of infertility and not being able to get pregnant, you might want to check them out for endometriosis. Periods might, be characterized by bloating, diarrhea, constipation. We already talked about that. So who is most susceptible to endometriosis? Who gets it? There is some suggestion that if you have a family history of endometriosis, you're at greater risk. I've certainly seen, this run in families. Certainly as an OBGYN, I do have an opportunity to treat across the generations, taking care of grandma, mom, daughter, granddaughters, etc. So I certainly have seen this. The other people that may be at an increased risk for getting endometriosis are people that have uterine abnormalities. Any kind of outflow tract abnormalities will put you at an increased risk for endometriosis. If you have a history of short menstrual cycles, i.e. less than 28 days in between periods, a history of starting your period at an early age, or even a history of not having kids, all of these things may make you more susceptible to getting endometriosis. So what are the treatment options for endometriosis? Treatment options fall under one of two categories, medical or surgical. Medically speaking, non-steroidals, pick your favorite one. These are medications like Motrin, ibuprofen, Aleve. you can use those. And then there's a slew of hormonal options that range from, oral contraceptive pills, the NuvaRing, some more aggressive treatments such as, Depo-Lupron, Depo-Provera, etc. The issue with using hormones, and it's not even an issue, but how they work is that they help to quiet the ovaries so that they don't produce as much hormone, as many of the hormones that are responsible for the formation of endometrial tissue on a monthly basis. So certainly when you are on something hormonal, your periods tend to be lighter, less painful, shorter. Sometime in patients with endometriosis, we will put them on, birth control pills where we have them skip the placebo week, again, just so that they have, fewer periods. And with regards to surgical options, minimally invasive surgery can be done to diagnose endometriosis, having something like a diagnostic laparoscopy. If you do have signs of endometriosis at this time, i.e., with the laparoscopy, we can remove cysts, which are typically endometriomas. Those are the cysts that are associated with endometriosis. And we can also remove any obvious sites of endometriosis. And endometriosis can be anywhere. It can be on your ovaries, tubes, in your cul-de-sac, on your bowel, on your appendix, abdominal wall. I mean, it really can be anywhere. So what do I think women need to know about endometriosis primarily? Basically, that it's a treatable process. And if you think that you have it, I definitely think that you need to see your OBGYN to talk about it, discuss your options. Just know that you don't have to be in pain constantly. A lot of women think, oh my gosh, I'm in pain on my period. This must be normal. No, it's not normal. And there are things that we can do about it. So that's endometriosis in a nutshell. That's the rundown. And certainly I didn't give you every tidbit of information, but I think that I've given you enough information, for a good start. So thank you so much for tuning into today's podcast. I love, love, love all the love that you guys give me, all the support that you guys give me. If you have a topic or query that you want discussed on the podcast, you know how to reach me, www.askdrangela.com. That's AskDrangela.com. From there, you have access to all of my social media outlets, Facebook, Instagram, Twitter. You can follow me there. I would love for you to follow along. If you want to direct message me, you can. If you want to shoot me a private email, you can. You can also sign up for the podcast as well as the weekly blog post that comes out. I have to mention, my book's dropping April 9th. There's still time for you to sign up to be a reviewer. If you're interested, just shoot me either direct message or shoot me an email and I'll send you a preview copy of the book. I would love to hear what you have to say. So as is the usual, I'm going to leave you with a quote from one of my favorite instruction books. This is Life's Little Instruction Book. And I'm going to leave you with lesson number 304. Judge your success by the degree that you are enjoying peace, health, and love. I'm going to say that again. Judge your success by the degree that you are enjoying peace, health, and love. And this one actually really kind of hits home to me because this year I'm going through a lot of changes. And so I'm just reprioritizing a lot of things in my life and trying to focus on those things that really matter most. Certainly we have like tons of material things, but those things come and go. But that thing about peace, health, and love, those are priceless. So until next time, look better, feel better, be better. I cannot wait to reconnect on episode 289 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.